What type of therapist are you? Well, greetings everyone. Saw this question posed in a online discussion for therapists, and people were instantly saying, well, I'm a trauma therapist, or I'm an anxiety therapist, or I'm a depression therapist, or a couples therapist. And then it would get into theoretical gestalt therapist, DBT therapist, CBT therapist, those kind of designations. And I kind of see the wisdom of having, you kind of differentiating yourself from others in the marketplace, and certainly certain um, issues people tend to work better with than not. But if you've done any research and reading about the common factors in psychotherapy, we found that our techniques and our theories are really the most minimal aspect of what generates change. The change is in the interaction, the therapeutic alliance we form with the client. And certainly the techniques and theories help us, but not at the level that we need to become attached to and identify ourselves with. I mean, someone were to ask me, what kind of therapist are you? I guess my initial comment would be a strategic, solution-based, Ericksonian. You can come up with all these labels. But when I think about it, I think the bulk of what we're trying to do in most forms of therapy, I'm paraphrasing from my good friend and mentor, Dr. Rob McNeely, who's said something similar, that all we're trying to do, rather than to be a trauma therapist or an anxiety therapist, all we're trying to do is have an interaction with our clients that helps them move closer to accessing their own strengths and resources to help them to navigate their lives in a more effective way. So if we're helping people by our conversations and our interactions gain access to the strengths and resources they have, that inner wisdom, that inner healer that they have, then we don't have to get so hung up on a label. We don't have to get hung up on a technique. We don't have to get fixated on doing therapy in a regimented way. We can just be that person that's a co-creative agent in the interaction to help people become a little more connected to the wisdom that's down inside every person. We have to have that belief that every person has all the resources they need inside, and to become reconnected to those, and to be solution oriented in helping them become, I guess, investigators of their own selves, to find those strengths that they intuitively do have to navigate their lives, to make their lives better, to transform and transcend the present stuckness that they find in them. So I'm not saying not to with your marketing, I'm a trauma, everything's trauma now, by the way. Trauma, cognitive behavioral therapy, trauma this. And if that's your bag and that's where you are, fantastic. Put that in that label. If you want to differentiate yourselves with your theory, that's fine. But if down deep, our goal is that we're having those transformative interactions, then it really doesn't matter. And it can give us more freedom to help and to become more open to other ideas, perceptions, and not so rigid in a pathology framed view of interaction with our clients. So, what kind of therapist are you? What type of therapist are you? I hope that my clients feel I'm an effective one. Have a great day.